Hi everyone, this is Biancake, also known as Biancake. I'm a gamer, gaming influencer, and I play video games for a living. So today is my CSA day. I'm super duper excited, guys, kasi actually si Dr. Contessa is my go-to doctor whenever I have problems with my skin. And parang hindi ko na alam yung gagawin ko. For example, skincare or ano ba yung nagiging problema ko with my face and skin texture. Or basta lahat ng problema ko, si Dr. Contessa agad yung naiisip kong puntahan. So, today, yung sinabi ko lang naman problema ko kay Doc. Sabi ko, Doc, parang yung photoshoot ko, nararamdaman ko na may parang shadow dito. Ano ba yung okay gawin? Sabi niya, alam mo na, pumunta ka lang sa clinic ko and ako na bahala sa'yo. So, let's see. Mamaya, papakita naman ni Doc yan. And of course, guys, sa lahat ng mga gamers or non-gamers na nanonood ng video na to, don't forget to follow and subscribe the channel of CSA Medical and Dr. Contessa page.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll be doing a so-called facial reshaping and facial rejuvenation. Before that, let's welcome for the first time, Miss Bianca.
Yes!
There.
Oh my gosh, guys!
Yeah.
Hello everyone! I'm super excited and I'm super honored to be with Dr. Contessa right here.
The honor is ours. Okay. So, Bianca is 20-ish. Okay.
Ish.
20-ish, okay. She's very young. And actually, these kinds of procedures, people are thinking that, oh, it's not for you. These are for like the older group, right? But nowadays, because of, you know, the lifestyle that we have, plus the recent like pandemic with all the stresses, kind of like the aging process got accelerated. And they were saying that aging starts at 25. Okay. Although for others, it's not the aging process. It's something like inherent or something you inherited. Like you have facial features that you already had since you were young. So it's something in your genes, right? So a while ago, we were discussing, Bianca, right? Is this something like I already had, I inherited? So in those who are in the age of 20s, they have facial features that they had inherited from their parents. Okay, so it's not your fault.
Mom, Dad, ano ba yan? Kayo ha?
But a certain portion of that, actually, okay, so nowadays, even teenagers, you know, or those in 20s, they have some so-called sleepless nights, or rather, they don't sleep early. Ayan.
Or maybe we don't sleep at all.
There you go.
Yeah,
So,
we gamers po kasi most of the
right.
time we're in front of our computer.
Correct.
So hindi namin natatansya kung anong oras na. And nasabi nga
Tama.
din ni Doc na may radiation or...
Exactly. Even the ones on the screens, your TV screens, they emit a certain radiation or ultraviolet wavelength that can go into your skin and may affect all those tissue extracellular matrix, those fibrous proteins like your collagen, your elastin, glycosaminoglycans. So we are unaware that there could be this molecular defragmentation already. So like as time passes by, gradually you're noticing fine lines, wrinkles, or a bit of like sagginess, or your skin is getting loose, or there's laxity already, okay? That's why we say nowadays, the earlier you start, the better to prevent the progression of aging, okay? And in our practice in aesthetic field right now, so we have a lot of these so-called products that are natural and products that are very safe and products that are also found inside your tissues. So some like of those collagen proteins or glycosaminoglycans that we can use to bring back the clock of time or correct anything that you had inherited from your parents, okay? So we have a topic today, the so-called facial reshaping, and at the same time, facial, I say, prejuvenation. Pre is prevention, and juvenation. You rejuvenate in advance. Okay, prejuvenation. So I did a facial mapping on Bianca a while ago, and I was assessing the proportions of the face. Terms of rule of thirds. Yun yung upper third, middle third, lower third. And I was explaining to Bianca, since we are Asians, okay, it's common among Asians. Hindi lang ikaw. So this is something you inherited, okay? So I noticed on the lower third, kind of like shorter, making her face kind of like naka-stretch siya horizontally, kind of wider because we have short face. That's why Asians, we have round-shaped face, right? And then compared to Caucasians, they have elongated shape of face because they have these proportions of 1, 1, 1. That's the ideal proportions, equal. So that's the one that we will be doing today. So somehow we'll reshape your face because ideally right now we want the oval. That's why like Bianca, she's doing this kind of like your hair is covering the sides of your face, giving that illusion of like an oval, elongated type of shape. So reshaping and of course rejuvenation. So what kind of treatment, what procedure, we'll show you when CSA Medical Aesthetics return. Back. So we are the part of doing a so-called facial assessment and facial mapping. Okay, so upper third, middle third, lower third. We already mentioned that the lower third is kind of like in terms of the ratios, it's shorter as compared to the upper and middle. And so what I do is usually I do a marking for my temple fusion line here, lateral orbital rim there, and then the superior border of your zygoma, inferior border of your zygoma. Then I subdivide the face into two, like the non-mobile and the mobile zone. So the posterior aspect here, this is where we have this like a strong connective tissue septa that holds our tissues towards the sides of the face. And usually the medial aspect, that's the one that sags, or that's the one that we notice we already kind of like have the so-called ptosis or yung tinatawag na lumalawlaw na. Right, Bianca? So I also noticed that the right side is saggier than the left. So when I was doing also her assessment a while ago. Okay, so this part here I subdivide. So can you cleanse for me, please? There you go. So I need to palpate the anterior aspect of her masseter muscle. Okay. So my concern also with Bianca, apart from having a lower third that is shorter compared to the upper and middle, is that the nasolabial here, okay, is already saggy, right? And then this part here, the lower, the corner of the mouth. Na-notice mo rin, Bianca? This part is sagging already. This is our concern, right? And there might be a beginning so-called marionette line already. So a problem of a nasolabial fold and a marionette fold. And this nasolabial fat, this fat here, is already downwards. Plus this tissue here, which is actually a part of our jowl fats. We have a superior jowl and an inferior jowl. So at this part, it's not yet bulging here, okay? But the upper jowl is already bulging. So if you check and analyze, you're noticing already this medial aspect of your face. Yan na yung nagsasag. That's the one that's going down already. So of course, we want a procedure that's non-surgical and that is very safe, okay? So ideally, when we have like a saggy fat there or an excess of a fat, we do a so-called lipolytic treatments, like either an energy-based device or the so-called lipo injections or yung mesolipotherapy. Narinig mo na yan, ha?
Apo.
So we inject the fats. But those treatments, we wait for the result. you don't see an instant result. So right now, we want to do something that we will see an immediate effect, right? And Bianca is so busy. We want to do something na, of course, meron ng result agad, okay? So what I'm gonna be doing for her is to kind of strengthen structures in the face that is responsible for the support and the lifting. So we will strengthen those areas, and those areas are usually in the periphery of the face, the outer portion of our face. So dito, okay? And then we will also be doing a so-called support. So if we restore the strength here on the lateral, on the posterior, we can also restore a support in the center, sa gitna. And the center that we will work on will be the chin part, okay? So it's kind of like strengthening here. So feeling this part here, mahihila na yon, no? And at the same time, feeling this part here, treating this part here with that kind of projection and elongation. So you're stretching yung medial aspect. Did you get the idea, the concept? So we will be working on the outer, the periphery, and then in the lower chin, and at the same time treating the short lower chin and doing the reshaping. What kind of product are we going to use now? So we already have the so-called Vicross technology type of product, which are your Juvederm Voluma and Juvederm Volux. So we have them now here with us. They're made up of hyaluronic substances which are naturally found in our system. Okay? So these are natural glycosaminoglycans, and they will help in rejuvenating, and at the same time, we can do lifting. So ito yung tinatawag na liquid lift, and also giving support and restoring that volume. And also, your hyaluronic helps in skin hydration. So also improving the surface of the skin, giving you that radiance. Ang dami. Okay? So my procedure right now will be more of injecting dermal fillers. I'll be working on the temple here. So this corner of the eyebrow. And at the same time, I'll be working on these zygomatic arches here. These are support structures. And I'll be working on the so-called preauricular region. I'll be restoring volume there. And also, the deep sulcus here, we'll be filling that in. And the lower part of the chin, the mandibular bone here, we'll be filling that in. Okay, and the chin apex. So those are your treatment plans. Okay, and then now let's do the procedure. Of course, with any non-surgical treatments that we're doing, we have to cleanse the skin, put our numbing cream, and we'll be using both needle and cannula. So a while ago, we had a numbing cream, lidocaine cream. We left it for about half an hour. And at the same time, I have a cryogenic spray as my anesthesia also, okay? So I just need you to turn to your left side. So we're starting on the right side face, okay? So I need you to spray that because I already had my new gloves. Okay. I'll be starting on the temple region because I noticed with Bianca, there's beginning temple volume loss. Okay, we wanted to improve that. And now I have a so-called voluma here. And so disinfect the skin. Now this part here, it's very important that you know the anatomy of the temple area. For doctors doing injection, you should master anatomy, what will be the structure that you will be avoiding here, and what is the anatomical layer that you will target, what is your tool or accessory, what is the product, how much of the product will you use. So those are important things that you have to know when you're doing this treatment. Okay, so tail of the brow, so you can lift the skin like that and direct it onto the bone. So supraperiosteal, Bianca, immediately bone already. So meaning to say, you lack volume in your temple already. Okay, Bianca? Okay. So somehow you're doing a treatment that will help fill in the temple and restore volume there and prevent hollowness of the temple. Plus at the same time, whenever we do this, it gives that instant lift of the tail of the brow and the corner of the eye. Okay. So filling in that temple. So I'm starting on the upper third of the face. So this one you can inject slowly, okay, gradually, and we'll be using a so-called 0.5 ml of my Voluma here. Voluma is under Juvederm Allergan. It has the so-called bi-cross technology. It has a good cross-linking, making your product very stable. Okay. And actually, in terms of the effect, they last longer. So they stay in our tissues longer, okay, as compared to other short lifespan products. This one is really excellent in terms of how long it stays and in terms of the safety of the product material. Super trusted product, right, Bianca? I was sharing with Bianca, this has been like in the market for a very long period of time. It's been like decades already. We've been using it for a long time. It's really trusted. And so once I finish injecting my 0.5 ml, actually after this, instantly you'll see an effect. We'll be finishing first the right side of the face and we'll observe if there's like a big difference already in doing this kind of treatment. So the goal is to lift that saggy nasolabial as well as the saggy jowl part or the corner of the mouth. Right, Yanks? And it's giving her that kind of sad face also. Or sometimes people think that you're tired or puyat.
Or not happy.
Or unhappy, sad, yon. So we'll make our face happy looking. Now I'll proceed to the zygomatic arch spray, please. So I'm just doing like a needle technique, bolus injection. Okay, there you go. So this one is a cryogenic anesthetic spray so that Bianca will not feel the pain here. So I'm in the zygomatic region and I wanted to inject onto the zygomatic arch here, onto the bone, and then aspirate a bit. And I'll be giving like a 0.1 here, 0.1, and then anterior to that, about 1 cm anterior to that, another 0.1. It's my habit to do an aspiration before pushing any product material. Okay, so there's nothing wrong with that. Doing that is kind of like gives me peace of mind. Okay, another 0.1 there, and then we're gonna do the posterior aspect here. So 3 injection point. Okay, onto the bone. Okay, I am on the zygomatic arch. Okay, there you go. So Bianca is slim, thin, not much of a volume on the face, right, Bianca? Okay, so after that, we'll do filling in of the preauricular region. I'll be using my cannula for this part of the face. So for this part here, I'll make an entry point. Okay, so spray again, please. And then just the entry point here. There you go. So I'll make a tiny prick, an entry point prick. Okay, just a minimal prick there. So Bianca has a thinner skin tissue. Now when you do your preauricular, it's expected that there is a so-called, what we call kind of like adhesions here. Okay, and she's still young. So we'll be using like a minimal amount here, a minimal dose here. So you direct your cannula towards that preauricular region, okay, up to the tragus part. Okay. So there will be some resistance. That's fine, that's normal, okay. So since we're using a cannula and we're staying on the so-called subcutaneous layer, layer 2. So a while ago we were on supraperiosteal layer, right now we are subcutaneous layer. So I'm just doing a so-called fanning technique here. So I'll be applying about 0.5 ml of my product. Okay, and done with a half ml. Now let's proceed to the chin area. Okay, so I'll be using Voluma for this deep sulcus here, and my entry point is just at the diagonal line of my. So the concern here is the bulging of the corner of the mouth. Okay, spray. So again, cryogenic anesthesia for the comfort, instant anesthetic effect. So this part here, just a tiny prick, and this one here, and OS please. Okay, there you go. So I'll inject at this part here, okay, doing my gliding there. So there are also some additions here or some fibrosis here, and Bianca had acne in this area, right, Biancs? Yeah, there are some acne marks, okay? So, well, Bianca is working on a daily basis, so, and also for women, right, hormonal, because of our hormones too. There you go. So we're filling in this part here, and we'll also be filling in at the chin apex there. We'll be using another syringe. I think I'm on a second syringe here. Some people are asking me like how many ml or how many syringes would you need? Well, it depends, okay? So you have to do your physical assessment first before doing any procedure and do your treatment plan, and just, you know, write down everything that you need and how much of the filler will you be doing, okay? So we had some pinpoint there, and then I'm gonna direct it into the apex, okay? Ideally, you maintain a sterile field. We'll be placing about 0.2 to 0.3 here. So our goal is to elongate the lower third and reshape the face, right, Biancs? So placing like around 0.3 there only. Then after that, I'll be working on the mandibular border, and I'll be using the so-called bullocks of Juvederm. So I'll be making another entry point here. So actually, Bianca has thin skin. Okay, you have like a Chinese descent, right? I will be pricking at this inferior border here, and this is already our so-called bullocks. Okay, and inserting through that entry point, puncture point, and just glide it in the inferior border of the mandible bone, okay, the jawbone. So we're working on the chin part, okay. And for those who have like pre-jowl sulcus, this is also a treatment for them, okay. And for those who have like saggy jowls, this is a support treatment, okay. And injecting into that part there, so we'll be pushing a little bit up to the apex. Okay, we're almost done on the right side. Okay, there you go. So this is like a part that has like an adhesion or some fibrosis. Okay, and Bianca has thin skin. Now, Biancs, your family line is Asian Chinese, right? Yeah. That's why Asian Chinese skin is also beautiful. Fair skin, right? Fair skin, light skin, brighter skin, right? As compared to Filipinos. Filipinos were the brown. Okay, so we're done on the red side. Let's proceed to the opposite side. So we have done doing our injections of dermal filler using our Juvederm Voluma and Volux. We'll show the result to Bianca when CSA Medical Aesthetics return. Back, so we're about to show the result to Miss Bianca. Ay. Bianca, here's the mirror. Wow.
Oh
right?
My gosh.
Yeah.
Oh
the contour of the face, those saggy mid-face area, the nasolabial, and this jowling here, the superior jowling there. Actually, they were reduced already.
Instant result.
Instant result. There you go. Because we wanted something that will deliver an immediate outcome and something that is really like balanced, harmonious, and it follows the rules of ratio and proportions. So 1, 1, 1. So we were able to also lengthen or improve the vertical dimension on the lower aspect of the face, particularly the chin region. We gave a very good contour here on jawline and the chin area. And also I could say on her lateral view, the OG curve, so the cheek was also improved without touching the anteromedial cheek yet, okay? Because we're doing a sessions for Bianca. So what we did right now are the outer parts of the face. So if you have a circle shape, so what we did was the outer portion of her face, temple, zygoma here, preauricular, and the inferior border of the mandible and the chin as well. So outer portion to pull, to lift, and here the center, the chin, to stretch anteriorly, project it anteriorly, to stretch the saggy jaw here, the upper jowling here, and improve the beginning marionette, plus also lift that corner of the mouth. Okay, so this is a treatment using our Juvederm line, the Voluma and Volux. Any comments, Miss Bianca?
I'm super happy with the result, Doc. Talagang instant siya. As in, yung naramdaman ko kasi, Doc, ang dami po kasing in-inject kanina. Parang, ano kaya mangyayari sa face ko? Pero, grabe, parang siya naging proportion na. Yung nakaraan pong sinabi kong problem, Doc,
yes,
yung talagang yung saging dito. And
right,
talagang sobrang visible niya.
Yeah.
So, yung ngayon, parang hindi ko na siya makita.
Yeah,
and
right.
Tinignan ko po sa mirror kanina, every angle,
right,
parang mas naging proportion po talaga siya.
Correct. Yeah.
Kasi po parang takot po talaga akong mag-picture dito sa right.
Yes.
Kasi parang may sunken nga po na kanina
Right.
nabanggit
Yeah.
nyo.
Yeah.
Ngayon po, nagkalaman siya and
Right.
then yung na-volumize, yung sa tama at perfect para
Right.
sa kabila
Yes.
naman sa face ko. Excited na po ako sa mga magiging shows and
Right,
shoots ko!
yeah. So I actually didn't touch any more angle of the mandible because a while ago I was assessing this. She has already a good mandible angle here. So it's basically more of the temple, zygomatic arch, this preauricular region, the pretragus area, and the chin and the inferior border there. So there you go. And we're excited with the journey of Bianca with us. So actually this is a session 1 for her. And I was explaining to her, you still need to work on the periorbital region because, you know, she works a lot. There are nights that she lacks sleep. And so we need to, of course, prejuvenation. Do something about it already, okay? You have to hydrate the tissues. You have to replace the missing glycosaminoglycans. You need that, okay? And the earlier you start, the better, okay? Don't wait for those saggy tissues, lines, wrinkles, folds to be more severe because if it becomes more severe, the more treatments that you will need. If more collagen were broken or you lose most of your collagen, you need more treatments, okay? So good thing for you, she's starting early and we were able to do a reshaping, recontouring, and you can tell your parents now, Mom, Dad, look at me. Okay. I'm improved and a lot better and feeling more confident. Okay.
Yes, yes.
Thank you so much, Bianca.
Thank you, Doc, for existing.
Glory to God. Amen. So, if you have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, or Instagram, CSA Medical Aesthetics. By the way, Bianca, you have an Instagram so they can follow you and check on you?
Hey guys, I stream online. You can follow me on my Facebook account. Just search Biancake.
There you go, Biancake. And our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9190 or 0917-504-4268. And please do watch our other videos. Just look for Contessa Salvador. Okay, thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.